However, another great at-home option is at-home dermal rolling. This is a really hot topic, but it's also one that carries a big word of warning.
I'm your host, Michelle Dreilich, and I am on a mission to change the way women age. And I'm going to do that each week by bringing experts in their field right online with me, and where we're going to share the latest research so that we can help you live ageless. So today is a pretty exciting day. I'm joined by Rachel Varga. Rachel is super special. She is a board certified aesthetic nurse specialist, and she's been one of these for over a decade. She's an international speaker. She's a trainer to other experts, and a published award-winning author in this field of plastic and aesthetic nursing. This is really a field that I was unaware of until I met Rachel. I've always thought of skincare from the perspective of an esthetician, not necessarily a nurse or a clinical specialist. And so today we're just going to talk about all things skincare, rejuvenation, ways to physically stimulate collagen in our skin so that we get this glassy appearance to our skin. So I'm so excited to have Rachel join us today. Hi, Rachel.
Hey, Michelle. Hey, everyone. Thanks for having me on the show.
Oh, it's so great that you're here. So let's get started with this idea that, aesthetic nursing as a field and how you got into this, and really, what you see it evolving into, and how it helps women take control of their age.
Oh, this is a great question. And I'll actually share a little bit of my story. When I was about 25, I started to notice, some of the first signs of aging, fine lines, bumps on my skin, and I wanted to do something about it. And during this time, I was working as a pediatric ICU nurse, taking my med school prerequisites because I thought my path was to go on into medicine. And I received my first rejuvenation treatment, and I thought, I feel like I could have had better education and assessment and just a little bit more information along the way. And my father's actually a carpenter, so funnily enough, he actually trained me from a very young age. Oh, that roof line is a little crooked, or that car bumper is a little crooked. So I started to notice all of these, aspects and what was balanced and what wasn't balanced. So I developed that eye of half art, half science at a really young age, and my mother's a nurse as well. And with my first treatment, I thought, I would love to provide a higher level of education to other people that are starting to, go on that path of rejuvenation. And so I got into the field of aesthetic nursing, never looked back, and this is my passion. It's such a wonderful way to help people, but it's actually quite a bit less superficial than you might think, because a lot of women come and see me when they're going through a tough time. Say they've lost a loved one, or their partner, or they're recently divorced or retired, and they've just devoted their lives to looking after others. And it's a privilege to really help people at this time. So what I'm a part of is called aesthetic nursing for nurses, and then aesthetic medicine for physicians.
Ah, that's so fascinating. So we've talked, so first of all, I want to start off by saying I'm 51, and I wish that I could go back in time and tell my 30-year-old self to wash my face before I go to bed, right? Because the countless hours of working hard and playing hard and crashing into my bed at the end of the night without paying close attention to my skin. And so I found myself very quickly scrambling in my 40s when I started to notice the fine lines starting to set in, crow's feet, that little beautiful dimple between my eyebrows setting in, from all the years of living in the corporate world. That's right. That's right. And so now, at 50, I look at skincare so differently than I did when I was younger. And I think folks today in their youth are starting to get on this anti-aging bandwagon early, which is a great thing. But what do women who wake up at 45 or 50 and say, gosh, I never even thought that I should have a daily skincare routine. What is the one thing, how do we even just get started with a skincare routine?
Yeah, this is a really important topic, and there's actually two studies I just want to briefly touch on. So there is a study that looked at women, men and women that didn't wash their face for a month, maybe a splash of water. And what happened is they developed diffuse redness to their cheeks and along their nose. So a lot of times when people aren't washing their face properly, they're developing that diffuse redness, which is sometimes confused as rosacea. And as soon as you
Yeah.
start to look after the skin, cleanse, moisturize, sunscreen, exfoliation with using the right products that are right for you with clean science and research behind them makes a huge difference in the skin in as little as 2 weeks. The other study I just want to briefly touch on, so that if you're listening to this and you're in your late 40s and 50s, no, it is not all in your head that your face is changing. There's another study, I believe it was published in 2017, that looked at the shapes of men and women's faces throughout the decades of their lives. And women's faces change shape 3 times faster than men's do between the ages of 50 and 60. So those changes they're going to happen. So what you can do going into menopause, during and after menopause, to really look after yourself and mitigate those changes that are basically brought on by menopause and our change in hormones, your early 40s, you start to notice that as well, that like thinning of the skin, the crepiness. There's so much that we can do now, though.
Oh, that is a great point. I remember around 45 that I fell in love with my face, right? Like my skin. And I loved it. And I realize now looking back on it that what I loved about it, because I felt like this little chubbiness was gone in my face. And I felt like my cheekbones were more defined. And now that I'm in my 50s, I look back and I think, oh, that was losing collagen and muscle in my face.
Yeah, it's actually 3 things. It's bone,
Mhm.
fat, and soft tissue changes.
Yeah, wow. So exactly. And so I think women go through this evolution probably in their 40s, where we start to get a little bit more definition and a little more gaunt look to our face, and it is appealing in the very beginning, but it is a sign that that's probably the time to pay very close attention to what's going on under our skin level, right? So the cleansing and the exfoliating and having a good moisturizer and using a really good quality sunscreen is important.
Mineral-based sunscreen.
Mineral-based
Yeah.
sunscreen. That's right. None of the chemical-laden sunscreens for sure. And
No.
we'll go into the details of that as well. But so under my skin, right, under our skin is this layer of fat and soft tissue, and collagen is a part of that. So why don't you tell us a little bit about let's say, one of your favorite ways to physically stimulate collagen in the skin?
Well, actually, the most important thing that you should be doing to maintain your skin health is with your skincare. So morning and night, your daily routine, I have to say that's actually even more important than coming to see me or someone like me in an office.
Ah.
However, another great at-home option is at-home dermal rolling. This is a really hot topic. So you want to be getting your roller from a trusted source, so not on Amazon or eBay or a third-party website, but through someone like myself that really takes the time to understand where these products are being manufactured. A great resource I'm going to share with your audience is the Netflix series called Broken. The counterfeit cosmeceutical industry is actually more lucrative than the drug and trafficking trade right now. So it's really important to just be working with people that are going to guide you through that process. And then, of
Mhm.
course, laser stimulation for collagen. So I love erbium lasers, deep fractionated lasers. There's a couple of brands that I prefer and a lot of brands that I don't like in regards to laser technology. And the tech's always evolving. So it really just depends, what someone's individual skin needs are and their skin type and what technologies are going to be great for them. But in office, laser rejuvenation is amazing.
All right, so let's take a step back and go back to microneedling because I want to make sure we understand that and the dermal rolling. And so microneedling, the way I've always understood it, and so this is so enlightening and helpful, is I've always seen it as an in-office procedure where either they'll dry needle or they'll add serum to your skin and needle and actually stimulating the deeper layers of the skin to respond to the needling. And what you're suggesting is it can actually be done safely, right, at home, but with the right tools so that someone doesn't need
Direction.
to kind of be a slave to always going in and getting it done. And
Mhm.
it can be super expensive. I've seen it up to $3,000, right, to go in for microneedling on a regular
Yeah.
basis. So tell us, so it's a roller, you're saying. I know you've got a great resource on your website, rachelvarga.ca. All of this will be in the show notes as well, so that we can get you links to everything that Rachel's talking about. But what does it specifically do? So the needles or the roller with the needles in it is penetrating the top layer of the skin.
Mhm.
Tell us.
Have you ever aerated your lawn, or do you understand the concept of you take an aerator over the lawn and it
Mhm.
creates channels of openings into the lawn, and then you can sprinkle fertilizer on? Well, hopefully it's not Roundup.
Right. Right.
But anyways, it's the same thing with the skin. We use the roller to create these channels of injury, and then we can apply different products over top. So that's a copper peptide or a vitamin solution with maybe a little bit of retin A. But the trick is to use products that are determined to be safe, to be basically injected into the skin. You can't just use whatever serum you have. And it's good to
Mm.
have a good basic protocol at home to mitigate some of the redness and irritation that you'll initially get from using the roller and the actives like a retinol. You can't just dive straight into it. This is where a lot of people go wrong. And then they
Yeah.
think, oh, I was red, I had some flaking, and then they just stop using it. You have to know how to use it properly. And I have a patient in her 70s, and she can't afford to get laser treatments, injectables, and that's totally fine. So she's kept up with her rolling. Roller's about 150, and the products that go along with it can range from about 200 to 400. It depends what you're targeting. And so it's a great affordable at-home option. And she doesn't have a wrinkle on her. She's in her 70s, no brown spots. Her skin looks amazing. And I recommend this over spending thousands on in-office microneedling with PRP. I've just seen a lot of men and women not get the results that they wanted in regards to fine line wrinkle reduction, acne scarring removal. So I really find that if you're looking to spend money in a clinic, go more towards some of the laser options. And for example, a fractionated laser is like laser needling. So instead of needling the skin in a clinic, you can use really great technology to use a laser beam to do it.
Okay. So now we'll move from this microneedling into this concept of laser treatments and laser rejuvenation, because I've seen lots of different things out there, right? Somewhere where I go, they have a mask that they put over my face that has different types of lights
Mhm.
and sensors. So how about if you describe it to me, because this is foreign to me other than having it applied at the end of a facial. I probably haven't had a real laser treatment. I'd love to know about it.
So it sounds like you're getting light-based therapy, which is great. So there's light and then there's laser. So
Mm.
those masks that you find, I think some of them are probably going to be better than others, because what we want is you want a specific frequency in that light. And what the frequency or nanometer is going to be doing is actually targeting different things in the skin. And what it's targeting is something called a chromophore. So different wavelengths of light on the spectrum are going to be targeting like hair removal, redness reduction, brown spot removal. And so light's really good at doing that. So you can either have like your at-home LED panel or go into the office and get an intense pulse light. I love the BBL right now, broadband light. There's
Mhm.
actually two really cool Stanford studies that when people, one of them talks about how when people have these types of light-based therapies, intense pulse light, for getting rid of reds and browns in the skin, it's like taking a magic eraser to the skin. It actually helps people look about 10 years younger. And then there's another study that looked at the gene expressions. So Someone in their 30s, different genes are turned on and off. And then in their 50s, it's like the opposite happens. So we can use these lasers to actually change our gene expression of our skin cells. It's fascinating, and this is where the science of aesthetics and beauty and rejuvenation is going. It actually change your genes. And then there's another type of laser where the chromophore isn't like the hair, the reds and the browns. The chromophore is actually water in our skin, and it vaporizes the top layer off and can give some really great resurfacing. But a word of warning here is that there's a lot of lazy lasers out there, or lazy technicians. So you have to go somewhere where there's really great technology and where you have a technician that is really paying close attention to what they're doing and giving you a very detailed treatment. So getting to the eyelids, being able to do the contours of the nose and the lips, and doing the face, neck, and chest at the same time. Not just the face, otherwise you'll get floating head syndrome.
Yes, that's great. I know, that's wonderful. So helpful. And so Rachel has a free treatment planning guide, and I imagine that you explain kind of what you're looking for in the right kind of aesthetic practice when you're looking for someone to help you in this area of using lasers, or even if you wanted to have microneedling done in a practice. That treatment planning guide can help someone find the right person, the right qualified person, and so on, right?
The treatment planning guide is basically a daytime planner for your rejuvenation options. So I list out some wonderful treatments and then give you an approximation of how many times a year you should have it. And then there's pre and post recovery tips on there. So in regards to figuring out what could be right for you listening and how to find a clinic near you, I actually offer that through my one-on-one consultation. Because it's
Oh,
different
that's
for everybody.
wonderful. Great. So you're essentially connected throughout the country with
Yep.
professionals that are not lazy technicians using old technology. They're state of the art and up on the research like you are. Everything you're describing makes complete sense.
Even just having someone like myself, go to bat for you and check out some of the local providers in your area, I can tell pretty quickly the difference between a clinic that is just looking to make a quick buck based on the technology that they actually have on their website, and other clinics that just have really great technology and they don't have the technologies that are going to waste your time and money, that are like flaky lasers that might feel like a hot stone massage but aren't going to deliver results.
That's great. And there's so many, this area, as you said, this is billions and billions of dollars each year that women are spending. And if we're going to spend the money, we should be wise consumers in this area to make sure that we're
Yeah.
finding credible people. The other thing is, I think we've all been led to believe that, you can buy Retin-A over the counter, right? In a strength strong enough to induce this flaking and the redness, and we're told to kind of push through it. But it doesn't have to be that way. That's what I'm hearing you say, right? It's not that's kind of rudimentary ways of approaching anti-aging versus some of these newer technologies and methods.
I don't know about you, but I don't really have the option in my daily life to walk around with red flaking skin for like a week or two. Or,
Right.
actually even up to a month. That retinoid reaction phase can take almost a month to get through. So what I like to recommend is just dialing in your basic skin steps. I call it sophisticated skin. This is a little cheat sheet that everyone who books a consult with me, they get access to this. And so I just kind of break it down. So I'll give your audience a little bit of a preview of this. So really dialing in your cleansing morning and night, moisturizing morning and night, mineral-based sunscreen every single day, and gently exfoliating the skin a couple of times a week using a product that isn't like a sugar, salt, rice, or anything really granular like an apricot hull scrub or like a cranberry hull scrub, because it can cause micro tears. Do that first before adding your expensive antioxidant serums or your vitamin A. Because when you have those products on hand, you can mitigate the redness and flaking that can occur with using a vitamin A. But a little tip here is to start with a lower strength and then slowly graduate up to something a bit stronger.
That is great. So yes, right. So any of these vitamin A or retinoids come in different percentages of strength and different preparations, gels, creams, things like that. And so, what a wonderful tip. You also talk. I want to narrow in on this too because, we've done surveys with our audience and we've learned that there are women across the spectrum of the different products that they're using, and there are high quality products, there are mediocre products, there are really poor products. As you mentioned, there's this market where even if you're scrolling through Facebook, it's not unusual to see skincare products at a really great price.
Yeah.
And right, and I do market research all the time, right? And not that I'm looking necessarily to fix different things, but I try products all the time so I can share what I'm learning. And it's not unusual to see a product that looks very, very made in the USA. And once you purchase that product, it doesn't arrive at your house for 3 weeks. That's a sign that what you're purchasing is actually coming likely from China or any of the other Asian countries that are really hot on skincare right now. But the problem is they're not regulated, and they may or may not work, but worse, they might actually harm. And so, tell us a little bit about medical grade skincare and what that looks like.
Sure. Well, first of all, I'm going to share a really funny story because when I was learning a little bit about online marketing and, what people could get their hands on, I came across this really funny talk. It was actually a lecture at Facebook of this marketing guru, and he was telling a story of one of his friends who he made millions online because what he was doing was he made his own little jars up, and then he was going to Costco and buying like Lubriderm or Neutrogena or something like that, putting it in the bottles and selling it on Facebook. And so even if it's not from China, that could definitely happen. So if you're finding out really great brands from people like myself or other aesthetic nurses and physicians, and then you try and find it online off Amazon or eBay, it's not going to be it. And probably not. It could be expired. Also, that product could have been stored not at ambient temperature. So it could have been too hot or too cold, so the actives could become destabilized. So even if it's not coming from China, but it's kind of in that realm of just, it's sort of been tampered with, uh, even if it's not counterfeit. So what I recommend is working with different professionals that might have their own e-commerce, but they're actually still getting it directly from the manufacturer. And if you're not sure, you can always just email the manufacturer of that skincare company and ask, "Hey, is this an approved seller? Is this an approved provider?" So if you're ever not sure, do that. Because I can remember even I went to one of the chemists or drugstores nearby a number of years ago, and I was like, "Oh, my hair salon product is on the shelves here." I opened it up and it smelled like hot dogs. So this has been happening for a long time. It was like over 10 years ago, I swear. And so buyer
Absolutely.
beware.
I've had patients come in and say, I found this supplement um, on Amazon and it was a little
Mhm.
cheaper.
Yeah.
And they said, but the tablets leave an aftertaste. And I said, that product doesn't come in a tablet. That product comes in a capsule. So I agree with you. It's very difficult to tease out, even on a site that has lots of reviews and things like that. There are different tactics that can be used. So it's really important to work with someone that you trust and know has your best interests in mind. I think
Mhm.
that's a great point.
There is.
So,
I'll
go ahead.
just so some medications and formulations, other companies will actually take the chemical formulation and remake it. So in some instances that can actually be done, and it's done safely in other labs. But when it comes to like supplements and beauty care products and microneedling at home rollers, just get them from the experts that you trust.
I love that. I love that. And so we'll have a link to everything at the evolvingageless.com website, where you'll see all of these show notes, everything that Rachel has shared. In fact, Rachel has shared with our audience a 15% discount on anything on her site. So that's pretty exciting. And you can get that link right at, you'd use the code, I'm sorry, AgelessLX is the discount code. So you can go right to rachelvarga.ca and just use that discount code if you're interested. So just to wrap up, the number one tip for all of us to get started, right? You mentioned it, cleansing in the morning and at night, moisturizing. Let's hear it. Preach to us.
Okay, I'll preach it, sister. So cleanse morning and night with some type of cleanser. I love cleansers with a bit of glycolic acid, salicylic acid, lactic acid, not just your body wash. That doesn't count. And then a moisturizer that's basically functioning as a multivitamin for your skin. You want to just be packing your skin with really good antioxidants, peptides, things that are really going to be nourishing the skin and creating some wonderful cell signaling to make happy skin cells. And then mineral-based sunscreen to protect your skin, even if you think, oh, it's raining out. If you don't need your headlights or flashlight to illuminate your path, you're still getting UVA rays, even if it's cloudy and pouring. So use your sunscreen. And also, all of these devices, the blue light is actually reaching deeper into the skin than the vitamin A than the UVA and UVB rays. Just an FYI. And gently exfoliating a couple of times a week. But using the right stuff. So I noticed a big difference when you were talking about luxury products or expensive or high-end. That really means absolutely nothing to me. What matters is the research and the efficacy. So when I see people coming to me and they're like, oh, I'm using La Mer or Estee Lauder, Lancome, whatever, these are expensive products and they don't have great skin. But as soon as they start to use like a $70 moisturizer instead of a $200 moisturizer, and just a really great sunscreen, they don't need that $200 serum if they're using a really good moisturizer that's nourishing the skin. So it's not about just using stuff that's shiny. It's about the research. So the brands that I work with, they're backed by research. They publish their studies. They're used all over the world by experts like myself too.
And that is mind-blowing information, what you just shared, right? Because it's not unusual. You can walk into any higher-end retail store and purchase a $200 bottle of moisturizer or a serum from some of these, department store names, but also there are brands that are coming onto the market that look very scientific and very, very clinical. And at the end of the day, it's the packaging that looks that way. And it's meant to mislead us into thinking that these are highly researched products. They might put a doctor's name on the product. That doesn't always mean that there's science behind it and that a reputable practitioner was a part of that formulation. And so it's a great point that you make, that there may be a less expensive, healthier, more effective option out there than some of the brand names that are, kind of status symbols in the anti-aging world.
I have one final thought for your audience.
Please.
So when you're going to, say, a beauty store and you're asking someone that's working at the counter, a lot of times they're like a salesperson or an esthetician or a makeup artist, and they might not necessarily be seeing people coming back, 10 years after using this particular product, using photography to analyze the improvements. So that's the biggest difference between working with someone like myself, like an aesthetic nurse or an aesthetic physician, where we use photography to assess the changes objectively. That's what you want to be, that's who you want to be working with. So save your money trying to Google and DIY it yourself. Just find yourself someone to help you.
Get an expert friend. That sounds like a plan.
Yeah.
Rachel, thank you so much for taking time out of your day to share your expertise with my audience.
Thank you so much for having me.
Just fantastic. And just so everyone knows, you can go to rachelvarga.ca and you can use that code AgelessLX if you want to dial in and get your discount. But also visit the evolvingageless.com and you'll get details on how to learn more about Rachel as well. and even little handouts and things like that that we've got planned so that you can just download them right to your own computer and get started with your own skincare approach. Rachel, thanks again. Have a wonderful day, everyone, and keep on living ageless.
Bye, everyone. Thanks for having me.